everybody. Good evening. Thank you so much for joining us for the second week of our Limb-Girdle Muscular Dystrophy virtual learning series. My name is Kayla White, and I'm a community education specialist at MDA, and we are thrilled to have you join us for today's webinar. This learning series is part of our larger MDA community education programming, which focuses on bringing the neuromuscular disease community together around education and resources. Be sure to visit the community education section on mda.org for updates on upcoming events. We are recording today's event and we'll be posting it to the website for on-demand viewing at a later date. Please know that all phone lines have been muted. We will have a question and answer session at the end of the webinar, and you can use the chat feature to send in your questions. You don't need to wait until the end of the presentation to send in your questions. Feel free to chat those in as you think of them. I would like to thank our webinar supporter, Sarepta Therapeutics. We would not be able to provide community education webinars like this if not for their generous support, and we are very thankful and appreciative. For over 70 years, MDA has led the way in accelerating research, advancing care, and advocating for the support of our families. MDA's mission is to empower people living with muscular dystrophy, ALS, and related neuromuscular diseases to live longer, more independent lives. Our mission comes to life through these 4 pillars. First, care. Through our national network of MDA care centers across the U.S., we support individuals and families from day one of their journey. Second, champion. Through our advocacy and education efforts, we empower families with information and resources. Third, catalyst. Through our investments in research, we are furthering advancements in treatment discoveries. And fourth, community. Through programs like Summer Camp, our Connections program, and our community events, we are helping individuals and families build supportive connections and relationships. If you haven't done so already, we invite you to join the MDA community by registering with us. So I would now like to introduce today's guest, Dr. Amy Yotty, Senior Physical Therapist with the University of Iowa. Dr. Yotty received her Bachelor of Science degree from the University of California, Davis, and her doctorate from Midwestern University in Arizona. Dr. Yotty is certified in vestibular rehabilitation and is board certified in neurologic physical therapy. We're so excited to have you here today, Dr. Yotty, and the floor is yours.
All right. Okay. Hopefully you can see my slides from there.
Yes, looks great.
Great. Really excited that you guys were able to join us tonight. I have been working with people with neurologic conditions as a physical therapist for about 10 years now. And for the last 5 years of that, I've been able to be a part of one of the MDA care centers at the University of Iowa. And I've really enjoyed working both with the MDA and with the whole care team that I work with there. So excited to be able to share some information with everyone tonight. So tonight we're going to talk about a lot. We're going to cover quite a few different topics, including physical activity, mobility, and physical therapy. Oh my. I was at an elementary school production of The Wizard of Oz last week, and so this felt very fitting with the lions, tigers, and bears. Oh my. So with that, we'll get started. My goal tonight is that you're able to leave with an idea of what exercise is ideal for you and how to develop an exercise plan, as well as when is it a good idea to seek out a physical therapist or an occupational therapist, and what can they do for you to help you in your journey. So you're all pretty familiar with the basics of limb-girdle muscular dystrophy, but one of the things that I want to focus on here is that we know the muscles that are primarily affected are the muscles that are closer in towards, you can think of your belly button, or we call them the proximal muscle groups. So those are the muscles around your shoulders and also around your hips. And we often see a lot of involvement in the muscles in the thighs, the ones that straighten the knees, which we call the quadriceps. There are different subtypes of limb girdle that we see some more distal weakness, and distal is a medical term for being further away from your belly button, so your ankles, your hands, things like that. So you've probably heard from a lot of different places, whether it's TV or social media or your doctor, that there's benefits of exercise. I think that's a pretty well-known thing. The benefits can both be short-term by something simple like improving sleep, decreasing anxiety, and reducing blood pressure. but there's also long-term benefits that we get from consistent exercise. And that can be seen through stronger bones and better bone health, improved balance. And there's some studies that are actually showing that ongoing exercise is really beneficial for brain health and can reduce the risk for both depression and dementia. There's also a lot of cardiovascular benefits that can come with long-term exercise. So since we all know that it's good for us, that means that everybody's out doing their exercise every day, I'm sure. Well, probably not, because unfortunately there can be a lot of different barriers to exercise. It can be finding the time to do it, having the motivation to do it, or maybe, if you're not really sure what you should be doing, it can be hard to get something started like that. Another thing that we hear from a lot of our patients is that they have pretty significant fatigue. So if I'm telling somebody to go out and exercise, then, they might be having fatigue just getting through their day-to-day activities. So it's hard to be told you need to be doing more and doing some exercise when you feel like you don't really have any extra gas in the tank, if you will. So I want to just take a second to talk about fatigue. We know that it's a common problem. There's a couple of studies that have looked at fatigue and different muscular dystrophies, and over half of people with muscular dystrophy report fatigue. This is a big problem. I think sometimes there's a stigma related to people feeling tired and fatigued and that they just need to push through. And so I want you to know that this is definitely something that can be part of the disease process, and it's not a personality trait. That fatigue can come from a global overall fatigue, or it can also come in more specific muscle fatigue, maybe through the arms or the legs. So one of the things that has been studied is what is the impact of fatigue from exercise, and is there anything we can do to improve fatigue? So the good news is there are some strategies that can help with fatigue. I'll be very honest, none of these are quick fixes. Fatigue is something that when you're introducing exercise, there's going to be some ups and downs. And so it's really finding what's going to work best for you. The key is regular, consistent exercise. Sometimes when we start an exercise program, we're pretty gung-ho about it, and we start off really strong, maybe doing a little bit too much, a little bit too intensive exercise. And so we have this big peak in activity. And then that's followed by spending the next 3 days recovering from that activity. So what we want to avoid is big peaks in activity that then lead us so tired or fatigued that we can't get up and do more. I like people to think about when they're starting an exercise program, start and then finish before you feel like you have to stop. There also might be things we need to look at through the day of how you can conserve energy. And if you have access to an occupational therapist, they are really, really key in helping identify these strategies and have different resources for this. Making sure that you're getting enough sleep at night is a pretty obvious thing that can impact fatigue. And if you haven't been evaluated by a sleep doctor, that's a great place to start to see if there's any underlying medical reasons that could be contributing to either while you're not sleeping well or why maybe you're not waking up feeling very refreshed in the morning. And then sometimes the use of different mobility aids or devices can help. Again, this goes back to that energy conservation, but if we can find a way to make things throughout your day a little easier, it's easier to get some exercise into your day. So we know that exercise overall is good, but is it different for people that have limb-girdle muscular dystrophy? I'll be honest, the research out there is a little sparse. It's something that I hope we continue to see more and more studies done on. But what we do know from the research is that there is benefit to low to moderate strength and aerobic training. And what that can do is it can help slow down disease progression. Exercise can also prevent disuse atrophy. And disuse atrophy is kind of that move it or lose it type deal. So I know that if I sit all day and I don't use my muscles, over time they're going to get weak. Now, somebody that has muscular dystrophy also has some weakness that is going to come from the disease process itself. So there's kind of two different entities at play that can lead to loss of muscle. Exercise can help in both of those with slowing the progression related to myopathy, but also slowing that loss of muscle because our muscles just aren't being used. We also have found that aerobic activity can have the same improvements in different cardiovascular risk factors like hypertension, or blood pressure, high blood pressure, that it does for other people that don't have limb-girdle muscular dystrophy. And for everybody, if we can reduce the risk of obesity and type 2 diabetes, that's beneficial. So you can still get the same protective benefits from exercise with limb-girdle muscular dystrophy. So that sounds great. And I know you are all about to leave your computers and go start exercising right now, but we need to talk about, what is the other side of this? Is there a risk involved with exercise? So you can have too much of a good thing. Um, a lot of what is the right amount of exercise for you is going to depend on what your prior activity level is. I have some patients that have different muscular dystrophies that are still working out at a pretty high intensity, but it's been a lifelong activity pattern for them. So we feel that they can probably maintain doing that safely. It's a different story for someone who's just starting out with exercising. We're not going to recommend that they go into high intensity or high resistance training activities. Excuse me, because there can be overuse of your muscles, and that can lead to damage to the muscles. One way that you can kind of monitor yourself for this is if after an exercise session, you're fatigued for, hours and you can't do your normal tasks, you just have to go home and rest, or you're having increased pain or cramping, or you don't have as much strength after, that's your body telling you that that session was too much and you need to back off. I sometimes feel like when we tell people, you can do too much, it gets a little bit scary to want to start doing activities. So don't think about it as if you have one session where you do a little bit too much. You're not destroying your muscles. So we just don't want to overdo it over and over. So this is kind of the balancing act that we're looking at here. If we underwork our muscles, we're going to get that disuse atrophy. Those muscles aren't being used, so they're going to get smaller. We also see some declines in what you're able to do throughout your day, as far as things like getting up from a chair or maybe having more fatigue. There's also maybe a psychological impact of people don't feel as good if they're sitting for most of the day or being pretty sedentary. On the flip side of that, we want to make sure that we're not overworking muscles. Overwork can lead to that fatigue as well. It could also lead to pain and a decrease in muscle strength. So there's 4 main categories of exercise. And just like nutrition, and a well-balanced plate has lots of different items from different categories, a well-balanced exercise program is going to have different activities from each of these categories. So we're going to go through these now. The first one is aerobic exercise, which is sometimes referred to as cardio. And that's using larger muscle groups or multiple muscle groups. And it's usually a continuous rhythmical motion. Things like walking, swimming, riding a regular bike or an exercise bike. So one way to kind of determine what that low to moderate intensity is with aerobic exercise, which is what we recommend, we call that the talk test. So if you're working out at about a moderate range, you should be able to pretty comfortably speak in full sentences to somebody. And to look at a lower intensity, you should be able to sing. So I highly recommend singing when you're working out. Makes it more enjoyable anyways. But that's kind of, if you can only get out 1 or 2 words at a time, then you're working up in that higher intensity level. And overall, this is something that if you haven't previously been working out at that level, I would avoid that high intensity. You're going to want to keep balance and safety in mind for all of the different forms of exercise. Different things to consider. So if you live somewhere nice and warm out where you can go walking or biking outside or using gym equipment, if you enjoy group exercise classes, I think that's a great place to start because you get some social activity. The reason I have a little star here is because with the group exercise classes, we sometimes get into that group setting and it's really easy to push yourself to try and keep up, and that can be a good thing, but you need to make sure that you're working within the capacity that you have. So next we'll talk about strength training. So this is where we're trying to improve muscle strength and endurance. And there's a lot of different places we can do this, whether we're using weights, elastic bands, gym equipment, or sometimes just moving our body against gravity can be a really good workout. So some of the research that we know about strength training with limb girdle is that, well, there isn't as much as there has been on aerobic training. And there's kind of across the different neuromuscular conditions and muscular dystrophy, strength training has kind of been avoided for a long time, although we don't have a good reason for why, other than it could potentially do harm. But the studies that are out there have shown that light to moderate strength training is definitely safe. So I think in the future, we're going to find that we can maybe do a little bit more than we used to think we could. Because there is the potential for damage, it's good to start off with a physical therapist or an occupational therapist to kind of guide you through this initially. And you always want to leave at least one day of rest between working out different body sections. So if you work out your arms on Monday, then on Tuesday, you're going to work out something else. So those muscles have at least 24 hours, ideally 48 hours to rest before they get worked again. And remember that using your body weight and gravity is a great type of resistance. You're going to be monitoring closely to make sure that you're not overusing your muscles. And we talked about that a couple minutes ago. So making sure that the exercise is not interfering with your daily activities, and that you're not having increased soreness or pain or fatigue after your exercise. And I'll tell you that that counts for physical therapy as well. So if you are working with a physical therapist and you're leaving there just completely exhausted for the rest of your day, have that discussion with them and let them know how you're feeling. Okay. Flexibility and range of motion. I think we hear a lot about aerobic and strength training, and I think flexibility kind of gets pushed to the side. And I think that from a function standpoint, flexibility is so important. So when we have muscle weakness, then joints don't move as far because the muscles can't move the joint through the full range of motion. And so what happens is that joint gets stiff. If we're not able to lift our arm up over our head all the way and our arm isn't getting lifted up, then over time that joint doesn't move as far. So gentle stretching is really important and can help keep that muscle. Maybe you don't have the strength to lift your arm all the way over your head. Now there's ways that somebody can help you do that safely. And that's really important because being able to lift your arm over your head can help with taking a shower, getting your arm through a shirt sleeve or through a jacket. So those things are important. And I like to have people start with those very early on. The more flexible a joint is, the easier it is to move it, the less work it is to move it. And then again, that's something that might help with that overall fatigue. So just some general rules for flexibility and range of motion. You want to hold for at least 30 seconds, ideally 30 to 40 seconds, to allow that tissue to actually relax and get longer. If you think about a rubber band, if I stretch a rubber band and I just stretch it and release it, that rubber band is the same size. Now, if I stretch that rubber band and I hold it there for 40 seconds, when I let go of that rubber band, it's going to be slightly bigger than when it started. Now, some joints are pretty difficult to stretch without assistance, but there's different tools out there that can help with this. Or if you have a care partner that can help you with stretching, a PT or an OT can help train them on that. There's also, at times, braces or splints that can be useful for stretching body parts throughout the day, or maybe it's something you wear at night to get a good stretch while you're sleeping. Balance training is one of my personal favorites. I think there's this horrible rumor going around that balance is something that can't improve, that if your balance is off, your balance is just off, and that is not true. So our balance is controlled by 3 different systems in our body: our vision, our inner ear, and then the feeling in our feet and ankles. And so maybe you have some loss of feeling in your feet, and so we need to work on how you balance on different surfaces. People that can't feel their feet well are going to feel very unsteady walking on grass or gravel or any uneven surfaces. And so we can isolate those systems through really simple exercises that you can work on at home or in the clinic with your physical therapist. We also know that if you have weakness in your ankles, that can cause your balance to be off. If you have stiffness in different parts of your body, that can impair your balance. So a physical therapist can kind of look at all those different pieces and see which of those pieces we need to work on to improve your balance. So if we all had enough time to get 5 different categories of exercise done every week, that would be fantastic. The good news, though, is that we don't have to do that. A lot of different activities are going to include some cardio and some strengthening and maybe some stretching and balance. I also think that we have a vision of exercise being something very formal that we do at a gym or with specific equipment. And I want you to consider shifting away from the idea of exercise and just thinking more in terms of physical activity. Going out and working in the garden, you're going to be bending over, squatting down, getting back up, reaching. I think that sounds much more enjoyable than vacuuming, but arguably vacuuming is still a really good activity from an aerobic standpoint and a balance standpoint. But ultimately, you need to find something that you enjoy doing if you're going to stick with it. So, what's the best type of exercise? I think this is probably the most common question I get in clinic is, if what should I be doing? What shouldn't I be doing? And the best type of exercise is going to be different for everybody. So, it needs to be something that you enjoy doing. There's tons of research out there that look at what the key factor in success with exercise is, and what it comes down to is you have to enjoy it somewhat. If you hate what you're doing, the likelihood that you're going to be consistent with it is not there. And all of the benefits from exercise come from being consistent with it. So some people will say, well, what about yoga? What about swimming? Well, those are great activities if you like doing yoga and swimming. One thing about swimming is you have to get to the pool. You have to get into the pool. You have to change clothes. You have to get back out of the pool, change clothes, get back to your car. That's a lot on either end of the activity. Some people are going to be exhausted by the time they get into the pool before they've done the activity, and then they still have to get out of the pool and get home. So if the pool is something you love to do, great. If not, find something that you enjoy doing. Because, like I said, if you don't enjoy it, you're not going to stick with it, and then you're not going to find those same benefits. Before you get started with any sort of exercise program, it's good to meet with a physical therapist, meet with your doctor, just to see if there's any concerns from a heart or lung standpoint that you need to be aware of. And the American Academy of Neurology recommends that people with limb-girdle muscular dystrophy are seen in an interdisciplinary clinic. And so I'll make my plug here for the MDA website. You can go on there and type in your zip code, and it'll show you where the closest MDA care centers are to you. And these are places where you can get connected with a care team that's going to have good knowledge and experience working with individuals with muscular dystrophy. So if you haven't checked that out, if you're not already involved in a care clinic, I highly recommend getting set up with one. Typically, you don't need to go, we see some people every 3 months or every 6 months. So it's not that you have to be going there twice a week if it's a drive for you. But even if you can get in there once in a while to kind of check in with that full team, it's really probably one of the best things you can be doing. So overall, from exercise, we don't want to work to the point of complete exhaustion. So most people have heard the no pain, no gain saying, and throw that away. That doesn't apply here. It really doesn't apply in many places, but activity should be sub-maximal, meaning you should still feel good when you finish. You're not trying to work to the point of not being able to do another step or another repetition. That's working against yourself. You need to find the program that's going to work for you. Again, I can't stress enough, finding something that you enjoy doing, find something that you can do with a friend or a family member, because everything is, I won't say everything, but if you can find someone to help you make it more social and keep you accountable, that can be really beneficial. It's important to kind of reassess over time if your exercise program is still working well for you. sometimes if we have progression of disease, there might be activities that used to work well for you that aren't anymore. And so I tell people to really be self-monitoring and listen to your body. It's important that if you're exercising out on your own, somebody knows what your plans are. And this is something that I recommend to everybody across the board. Doesn't matter what the diagnosis is. I do it myself. If I'm going out for a walk alone, somebody knows where I am and when I'm planning to be back. So that's just a basic safety thing. But make sure that if you're doing something alone, somebody knows what your plans are. All right, we're going to talk about physical therapy. We're flying through this, so that's good. I added a couple more slides today. So the muscles that are typically impacted with limb-girdle muscular dystrophy are seen in red in this picture here. And so it's typically the muscles around the shoulders and then also the fronts of the thighs or our quadriceps. And so there's a couple things we see kind of across the board that are challenging when you lose strength in those muscles. I would say probably the biggest complaint that I hear from people is trouble getting up out of chairs or going up and down stairs. We see changes with walking, slower speed, loss of stability with walking. Because of the weakness in the shoulder muscles, there can be changes in posture, and that can lead to difficulty with shoulder range of motion because the way our shoulders are meant to work, they're meant to work when our shoulders are pulled back and in line with the rest of our body. When we have weakness of our muscles that lead our shoulders to this forward position, we aren't able to reach up overhead as well. And that's also something that we see just from a loss of strength in the shoulder itself, that getting the arms overhead can be challenging. So when going to physical therapy, regardless of what the primary issue is, these are kind of the general things that a physical therapist should be doing with you. Ultimately, the goal is to improve function and help you problem solve through the different challenges you're having, whether that's getting up from a specific chair or getting in and out of the car, in and out of bed. Physical therapists can also assess your risk for falls and help manage that risk if you do have an increased risk for falls. It is much easier to start working on your balance and addressing those issues prior to having recurrent falls. What we don't want is for people to wait to see PT until they're having multiple falls and ending up getting hurt. So being proactive about it is really a great plan. Sometimes there's different adaptive equipment like walkers or canes that can be recommended by PTs. One thing to keep in mind is that I'm a PT. My job is to make those recommendations, but this is your life and your journey. And so I'm never going to force people to change what they're doing. I just want to make sure that what you're doing, you've got a good education on what the different impacts could be. And then a big thing physical therapy can do is help with exercise prescription and getting you set up on a exercise plan that's safe and effective. So some other general components of physical therapy. Physical therapy, hopefully if you're receiving it, you're receiving it in a one-to-one manner. So it should be you working with the physical therapist. Group settings are great for some activities, but from a physical therapy standpoint, one-to-one, you're going to get the most out of your sessions. There's recommendation that you should be getting a physical therapy baseline evaluation every 1 to 2 times a year. If you think about kind of the dentist, you don't wait to go to the dentist until your tooth hurts. You go every 6 months to keep your teeth healthy. So that works with PT as well. And then at that time, what happens is we can pick up that, we can look at data over time and see, how are things changing? Do we need to get going on an episode of PT, or are you doing pretty well? Now, if you're involved in a care clinic, hopefully, you're seeing PT once or twice a year through there, and then they can help you make referrals elsewhere or more locally if needed. Typically, PT is delivered in episodes. So that episode, I put on here an example of 1 to 2 times a week for 6 weeks. But it's highly variable. It depends on what your challenges are, what kind of things you're working on with the PT, and what the ultimate goals are. I think there's sometimes people that get frustrated when they get discharged from PT and it's like, well, what now? Um, and PT doesn't go on forever. But the big caveat here is you do not have to be making improvement to justify PT. So I have a lot of patients that come in and say, well, I was getting a lot better with PT. And by better, maybe better is easier getting up out of a chair. Those are the things we're looking at. There might not be a change in the strength in your legs because maybe with where you are in the disease process, we're not going to see changes in strength. But that doesn't really matter if we can get you out of a chair easier. And so I hear a lot from patients of, well, they said since I wasn't getting better, I couldn't come to PT anymore. And so this is something that I want patients to be empowered to know about is something called skilled maintenance physical therapy. There was a class action lawsuit that went on from about 2011 to 2013. And this is the name of the case down here, Gemmo versus Sebelius. And basically, what came out of this Supreme Court case was that you don't have to be able to show improvement for PT to be justified. And so this is ultimately from a Medicare standpoint, though most insurances follow those rules. What does need to be provided is something that the PT is delivering from a skilled standpoint. So if going to PT is a convenient place to work out and they stretch you out, but they're not really needing to modify your program, you're pretty independent with it, you could go do it at the gym or at home, then yeah, that's probably not very skilled anymore. That wouldn't qualify under skilled maintenance therapy. But there are times when maybe, again, that disease progression is happening. We're trying to figure out different assistive devices that are safe and different modifications to home and your daily activities. And under that, you can be getting skilled services from the PT and you don't have to be showing improvement. So this is something that you may need to discuss with your PT. There's variable knowledge about this in the PT world. It's something we're actually studying right now. But I think especially in the neuromuscular population and muscular dystrophy, a lot of patients fall under where they would benefit from skilled maintenance therapy. So if you're being told, well, you've got muscular dystrophy, you're not going to get better, we can't do PT anymore, then either talk to them about skilled maintenance physical therapy or see if you can try going somewhere else that is more educated on the topic. So one of the things that we do in physical therapy is look at your walking and your strength and see if there's weaknesses or muscle imbalances that are causing issues. So I mentioned at the beginning of our talk that while a lot of people's weakness is in their upper legs, some people do have weakness in their ankles. And when we have weakness in the ankles, you can get what's called foot drop. And so foot drop comes from two different things. One, your calf muscle on the back of your leg is a really strong muscle. It's meant to pick your body up off the ground every step. And so its job is to point your toes. The muscle that lifts your toes up so that you don't trip when you walk is called the tibialis anterior, and that's a teeny tiny little muscle that runs down the front of your shin. So if you get weakness in the muscle that lifts your toes, then eventually you're going to get tightness in your calf muscle. And what that'll do is when you're walking, it's going to cause your toes to drag on the ground a little bit or catch. And sometimes this will be something as subtle as, every time you walk past a threshold in the floor or over an area rug, you're catching your toes on it. There's a lot of different ways people will compensate because our bodies don't want to fall. They're very good at figuring out what to do. So some people will do what's called a steppage gait, where they will lift their knee up really high to clear their foot. And while that's effective at helping you not fall, it takes a lot of extra energy for walking. So there's different things we can do for foot drop. One of those things is to consider looking at a brace for the ankle. This specific brace is called an AFO, or an ankle foot orthosis. And the things we need to think about with an AFO, it's not as simple as saying, well, you've got foot drop, let's get an ankle brace, because we need to consider weakness and strength in the muscles of the knee and the hip, which can also be impacted. And there's also a lot of personal preference with this. I have some patients that try the AFO on and it changes their walking and they love it and they want to take it home with them. I have other patients that want nothing to do with it. And again, that's your choice. My job is to show you the different options that's out there, see if it's something that we can try, and if it's not something that's going to work for you, that's okay. One of the downsides to braces is you have to wear them with shoes. So for walking inside the home, a lot of people don't wear shoes. So then if you're not wearing the brace in the house, you're still going to be tripping over your foot. Some braces can be heavy, and so that can increase energy expenditure with walking, although there are a lot more options on the market currently that are very, very lightweight. The other thing is some people trip over their toes and it has nothing to do with ankle weakness. So if the weakness is coming from higher up, then the AFO isn't going to fix the issue, because the AFO is only going to fix the issue at the ankle. So this is a picture of a carbon fiber AFO. So like I said, they're pretty lightweight, about 7 ounces. And these particular ones are off the shelf. So they're pretty easy to get. Most insurances cover them. And you don't need to be casted for them or anything like that. They come in small, medium, large. And then you would be seen by a prosthetist or orthotist, and they would just trim the edges of the carbon fiber foot plate to help fit in your shoe. Because these are pretty readily available, this is something that your care center may have for you to trial in clinic. We have a couple different options in our clinic that, if we're wondering about it, well, let's put it on and walk down the hallway a few times and see what you think. And then we kind of know right then and there, is it something worth pursuing or is it not? All right, assistive devices. So the single point cane, or just a regular cane or a walking stick, can be helpful depending on how much upper extremity or arm strength people have and just how unsteady the walking is. Canes are not meant to bear a lot of weight through. So if you're just needing a little bit of touch, or maybe you feel good reaching out and touching furniture in the house, then a cane or a trekking pole might be a really good option for you. And the picture here is a trekking pole. What I like about the trekking poles are they have different tips on the bottom. So if you happen to live somewhere in the Midwest like I do, you encounter 4 different seasons. So you can actually, in this picture, they pulled the rubber tip off and you have a sturdy tip on the bottom that gives you some traction if it's slick out. Now, don't go out ice skating just because, but you do get a little bit extra security if you are on a more slick surface. Here we've got the 4-wheel or rollator walker. One thing that I have people consider with these is if you have weakness in your upper legs or your thighs, you need to be really aware of how high the seat is. Now, most people with limb girdle are very aware of how high pretty much every seat they could sit on is. So when out looking at these, make sure that you're getting one that's either a tall version so that the seat's higher, or something with an adjustable seat, or the larger the wheels on the bottom, those casters are going to lift the seat up higher. So the red one here, oh, the bright red one, I guess they're both kind of red, but the bright red one is a European style rollator, and they tend to have a taller. This specific walker, the Drive Nitro, comes in a tall version, and the seat is pretty darn tall, which works well for a lot of people with quadricep weakness. It also folds up smaller than the burgundy one. The downside is it is more expensive than the burgundy one, and insurance does not cover it as well, and in some cases doesn't cover it at all. The benefits of the rollator walker is having support through both of your hands, and you're going to get a lot of energy return from that. It's also, if you find one tall enough for you, knowing that you always have somewhere to sit when you do get tired. I hear from a lot of patients how stressful it is to, go somewhere and not know if you're going to be able to sit down because there might not be a seat that's tall enough for you. I've had at least two different patients that carry around folding, let's see, in Iowa we call them bag chairs or camp chairs, but they're like the folding chairs you take to sporting events, but they found bar height ones that they take with them places to sit because then they know they can, yeah, captain chair. Yep. So those are just some different options. Maybe you don't need the walker from a balance standpoint, you just need somewhere to sit. That's something you could try. This is a combination rollator transport wheelchair. So maybe you have difficulty walking long distances. Either you get short of breath or you just run out of energy, but you want the ability to walk somewhat on your own. So this can be used to sit on the seat. It's got footrests that come out and someone can push you in it. Or you can stand up, the leg rests flip out of the way, and you can push it like a walker, just like the top left corner, the one in the top left corner here. Usually the next question I get is, well, can't I just sit on the seat of this one? And the official answer is no, you should not sit on that and be moved around on it because it's pretty easy to tip over. So there are some differences that make sitting on this one to be pushed around more safe. If you just want to sit for somewhere to rest, these work fantastically. So this is something that I like to show people. This is called a free to go walker. And what this is it's a rollator walker that has a hidden toilet seat underneath the seat. So if you're out in public or you're at somebody's house and maybe they have a low toilet, you can roll this over the toilet, flip the black seat out up, and sit on the toilet seat. And so then you have handles you can push up from, and you have a taller seat than what a public toilet would be. So I have some people that really like this. Again, it just comes down to how tall you are and what height you're able to stand up from, of if it'll be beneficial for you or not. But it's called the free to go walker. So it's something that if you're interested in more details, you should be able to look up free to go walker and find that pretty easily. We could probably spend an hour just talking about wheelchairs, maybe an hour just talking about power wheelchairs. So I tried to be concise here, but I wanted to at least mention power wheelchairs because, again, it's something like physical therapy where there's just a lot of misinformation that's floating around about it. The key point about power wheelchairs from an insurance standpoint, and this is primarily Medicare I'm talking about, although again, a lot of insurances follow Medicare's rules. But in order to qualify for a wheelchair, we have to justify it on what you're doing within your home. Unfortunately, insurance doesn't really care about your ability to go down the street or go to sporting events or get around the grocery store. They just care about what you do inside your home. So we have to look at how you're doing getting around inside your home, because just being able to walk inside your house doesn't necessarily mean that you would not qualify for a wheelchair. What we have to look at is, are you safe walking? Are you having a lot of falls? Or maybe you can walk, but you're really limiting how much you're doing because you're worried about falling, or you have trouble breathing, or you're just too fatigued to be able to walk throughout the day. Maybe you walk pretty well in the morning, but by noon, you're not able to get up and get to the bathroom without a lot of effort. So it's not a black and white. If you can walk, you can't get a wheelchair. If you can't walk, you can get a wheelchair. There's a lot of nuances to it. It's variable by every insurance company is a little bit different. And I would strongly encourage, if you're looking at a wheelchair and feeling like a wheelchair would be beneficial, getting with a PT or an OT for a wheelchair evaluation. Even if you're certain that, well, I really want something for outside, so I know that I'm not going to qualify for one through my insurance, it could still be beneficial to meet with a therapist and kind of talk about what different equipment is going to be best for you and to give you some suggestions. There's a lot that comes in as far as thinking about how you're transporting the device, what the weight capacity is of the device, and if you're getting something like a trailer for your car, what the weight capacity of the trailer is. Um, Most insurances, if not all of them, do require a wheelchair evaluation. And so it's a good, if you're going to get one through insurance, get the evaluation done. Um, the picture here shows the same wheelchair, but this wheelchair has what's called power elevating seat height. So you can see in the second picture, the chair's up taller. This one I think is a 12-inch elevating seat height. And so if you have difficulty getting up from a seat, having that seat elevate is crucial. Unfortunately, it is not covered by Medicare. It's not deemed medically necessary. This is something that is being looked at in the legislation right now, so hopefully that will change. But sometimes there's different ways to get alternative funding sources for the Power Seat Elevate. So again, it's something to discuss with your PT, discuss with the wheelchair vendor, but I just want people to know that it's out there. Okay, other adaptive equipment. So this is one that is very simple and I've had people use a lot, but if you look at this couch, there's the little gray furniture risers on each corner. These come in different heights, different colors to match your furniture. Um, they're about $30 to $50 depending on which ones you get. You can get them from Amazon, Walmart, anything like that. And most of you have probably experienced that, the difference between 2 or 3 inches can be the difference between getting up from a surface and not being able to stand up. So they're great because they're a pretty quick, easy, cheap fix that might give you some more options for where you're sitting. This is another option I've had some mixed success with from people, but being able to have something really solid to push up with the arms. Some people are able to get up a little easier from the couch. Typically, I see people use this with the couch risers. This alone doesn't tend to be enough to get up from a really low surface. And it is pretty expensive at anywhere between $100 and $140, depending on where you're purchasing it from. The easy stand cushion comes in a couple different options. There's some that are powered and you plug into the wall. There's others that are hydraulic. I've had a lot of variability of how much this helps people. I've had some people that swear by it and they take it everywhere with them and it makes a huge difference. And I have other people that used it and donated it because it didn't help at all. So if you have any way to try this before purchasing it, I would strongly encourage that so that you don't end up with something that's not going to work for you. Okay, this one I just found while I was putting this talk together. And if there's anybody out there that's used or seen this, I would love to hear about it. But they're marketing it as a portable lift chair. So it's kind of hard to see in the picture, but you can move it around. You can put it in wheelchairs, recliners. It's expensive, $600 for it. Though I've had some patients I've worked with that probably would have paid that just for the ability to not have to worry about where they're going to sit at a loved one's house or how they're going to get out of a wheelchair if they go to the doctor's office. So I'd love to hear from anybody if they've seen this. I have no idea how it works, like how well it works, but I put the website on here if anybody wants to take a look at it. But again, if anyone's tried this, please let me know. I'd love a real person review of it. Most importantly, don't go out and purchase a lot of things without either trying it or talking to a PT or an OT or talk to other individuals. If you're at conferences, this is a great place to kind of network. I learned so much from my patients about what equipment works well and what equipment doesn't. Those seat cushion lifts, a couple years ago, I thought were the greatest thing ever until I started seeing people try and use them that said, no, they don't work. So, if you find something that works, share that with your PT or your OT and talk about it in forums with other people because you're probably out there figuring out the solutions to a lot of these problems just day to day. And we want to help share that knowledge. Okay, I'll take questions now.
All right. Thank you so much, Dr. Yotty, for that information. So we have had a few questions come in the chat. Let's see. So someone has asked, is there any skilled PT that can help someone who has a really hard time getting off of the floor?
Yeah. Yeah, that's a great one to mention. Probably second from getting up off a chair, the other thing I work with is getting up off the floor. And sometimes it's as simple as figuring out different positions to get into and having somebody maybe bring a chair over, or bring a walker over to help get the person something to put their arms on. And sometimes we need to look at different lift equipment. But there's multiple types of lift devices that are out there that can help you get somebody up off the floor if needed. And physical therapists can help you determine what the right lift would be and also provide that training to yourself or a caregiver, um, if you are having, trouble getting up without the lift. But a lot of times, depending on the amount of weakness there is, if you can get some training, there's some tricks. We try and get people onto their hands and knees and then get their arms supported and pull themselves up from there. That doesn't work for everybody. Sometimes we go kind of sideways and scoot the hips up onto a low surface and go up kind of stepwise to get up to a standing position. So yeah, that's definitely something I would highly suggest working on with a PT.
All right. So this next one's not really a question, but I'm going to try and phrase it as one. So somebody in here said that they're 6 feet tall and nothing seems tall enough.
Yeah.
What kind of advice do you have for your
Oh,
tall patients?
yeah, it's really hard. I don't know off the top of my head what the seat height is of the Nitro tall rollator walker, but I know I've got people that have the Nitro rollator in tall and then put a firm cushion on top of it. Um, and it's challenging. I do think that one of the things we're going to see, I meant to mention this earlier, is I talked a little bit about ankle braces. They're starting in the bracing world to use some of the components that they use in prosthetic legs for amputees. They're looking at how we can use those in braces. And I do think in the next couple of years, we're going to see like powered knee braces that could help make up for the lack of quadricep strength. That's out down the road a few years, but I do think it's coming. So I'm hopeful. It's really challenging when there's low surfaces and you're tall and you have weak quads. But I would really encourage looking at the Nitro in the tall size. And then if you're putting a cushion on anything, you want a really firm cushion so that it's not going to squish down when you sit on it.
All right, thank you. I'm very short, so I don't know what it's like to have to struggle with something because you're too tall. Somebody has asked, what are there any benefits of swimming with LGMD?
Yeah, so swimming is great. It's gonna get flexibility, it's gonna get cardio, you get some strengthening in there. As long as it's something you enjoy doing and you're not feeling overexerted after, then I think that's a great thing to do. As far as I know, there is not any more benefit from swimming versus something else like walking or biking. But again, if you enjoy doing it and you feel okay after, then that's the best exercise for you.
Perfect. Something that you enjoy doing. That's a
That's
big one.
key. Yeah.
Um, do you have any recommendations for how to recover sore muscles after exercising? Foam rolling, hot baths, supplements, etc.
Yeah. Um, I guess one of my thoughts with that question would just be to kind of look at what you're doing. If you're having prolonged soreness that is to the extent where you're kind of wondering about how to recover, I would be a little concerned if that activity is maybe too intense or maybe you need to break it up across multiple days. So I know that doesn't really directly answer the question, but if we look back at the slide where we talked about overwork and underwork, having that prolonged soreness to me is kind of telling me that you're overdoing it a little bit.
Gotcha. Somebody's asked if you have any advice for travel, such as like long plane rides, and what can you do to protect your muscles?
Yeah. Um, Try and get up as much as you can while you're on the plane. I would just be that person that's getting up and walking back and forth along the rows of seats. You can, if you've got good strength in your ankles, you can pump your ankles under the seat while you're sitting, kick your legs around, just try and keep things moving to decrease that stiffness. That's probably the best thing you can do. If you're driving, then, get out at the rest stop and walk around a little bit.
What exercises can you recommend for those with LGMD who are too weak in the hips to stand and use power chair transfer boards?
Yeah, so there's lots of exercises that can be done either in bed or hope if you have a chair that can recline and tilt back. Um, if we can't move a muscle against gravity, so if you're not able to move that muscle on your own, then the best exercise for that muscle would be stretching and likely having somebody help you with that stretching. And then focusing on moving the muscles that you can move on your own, maybe doing some range of motion, stretching those muscles, and just working against gravity. But there's a lot you can do laying down, sitting in bed, sitting in your chair. Just kind of depends on where your specific weakness is.
And the question right after that also had to do with standing. Somebody asked how important is standing and what therapies or assistive devices are available to help with standing.
So standing, if you're not standing from a function standpoint, so maybe you're using a wheelchair and a lift device or a slide board or a transfer board, you don't have to stand to get there's no magical benefit from standing if you're not doing it functionally. There are some studies in different populations that look at the benefits of standing from a bone health standpoint, but really to get those benefits, you need the muscles to be contracting while standing. So something like a standing frame that's going to hold you up or having somebody else hold you up, it's not going to be very beneficial, and I think you're going to have a pretty high risk of overdoing it. So rather than forcing yourself into standing, I would just see what you can do in a more comfortable position and go from there.
All right, so we are kind of coming up towards the end of time, so we'll end with one more. Are there exercises to help improve nerve pain?
Yeah, so nerve pain is a tough one. Sometimes stretching can help with nerve pain as well as gentle motion, but I'm going to put nerve pain into kind of that same category as fatigue, where there's some known benefits from exercise and pain and nerve pain and chronic pain, but it can be kind of hard to dial in what the right amount is so that you don't flare things up.
Okay. So we do have more questions, but we're just not going to have time to get to those today. So if we didn't get to your question, I'm really sorry, but we want to be respectful of everybody's time. So again, I want to thank you, Dr. Yotty, for being here today. We appreciate your time, your expertise, and everything you do for the neuromuscular community.
Yeah, happy to be here.
So just a few closing notes before we wrap up. If you're new to MDA and are diagnosed with a neuromuscular disease under MDA's umbrella or are a loved one of someone who is diagnosed, we encourage you to stay engaged with MDA. You can do this by visiting mda.org/join and completing a short form. Joining is free and will keep you up to date on the latest research, educational programs, and supports. We would love to hear your comments about this webinar. If you have a smartphone, you can open your camera and point it at the QR code on the screen, and that will pop up a web page with a short survey on today's webinar. If you don't have a smartphone, no worries. It'll pop up after we end the webinar, and then you'll also get it in an email. If you have any questions after this webinar, please feel free to email them to mdaengage@mdausa.org, and we will follow up with you. So this concludes the second week of the LGMD Learning Series. Dr. Yotty, we are so thankful and grateful for you being here today with us and giving so much great information and tips on improving physical health and physical therapy. So thank you all.
Thanks for having me.
Thank you so much, and we thank everybody for attending, and we hope to see you next week. That concludes today's session. Thank you.